afternoon, everyone. Gareth Presch, founder, CEO of the World Health Innovation Summit. I am delighted to welcome you to our Innovators Show, where we highlight incredible solutions from around the world. My guests today are pure pioneers in this space, and I'm delighted to do a quick roundtable, shall we say, introduction. Let me jump across the water to the States. Olga, you're very welcome to the Innovators Show. I'm really excited to hear your presentation, but a short introduction, please.
Good morning. Thank you for having me. My name is Akinola, and I'm the founder CEO of a company called the Mother's Hub and a creator of the Preconception Readiness Score Index. So what we do is we get women ready for preconception, just a way of reducing maternal mortality.
Fantastic, and such an important topic. And now let's go to Switzerland. Vincent, in the middle of house moving, and that's why you have a brick behind you. Vincent, please tell us about FootSnap.
Okay, Gareth, thanks a lot for having me on the show. Yeah, I'm Vincent Piselé, and I'm the founder of FootSnap. What we do, we actually are building the world's largest biometrical database for the good of mankind for multiple applications. And well, we do this by using nothing more but nothing less than our smartphones.
Fantastic. And let me just go to Priti. Hi, Priti. I think you're in London.
Hi.
Are you?
I'm in Manchester, Walmsley.
Manchester. Okay, fantastic.
Yeah.
Just a short introduction, please.
So my name is Priti Patel. I am the director of Meds on Time. I basically created the world's first digital medication adherence toolkit to support people to take their right meds at the right time along the support care pathway.
Fantastic. So you can see we have real solutions, and let me just bring in some of the audience. So Patricia's joining us from the US. You're very welcome, Patricia. Anyone has any questions as well at the end, we might be able to get some time to ask some questions. I think, let me just spell out, like, the purpose of the World Health Innovation Summit is to be a platform for innovations all over the world. We're very much about empowering local communities, and you'll hear from our participants today the solutions they have that actually achieve that mandate, and we're all about promoting those opportunities. So let me start. Olga, over to yourself. Really excited to hear a little bit more about the work that you've been doing around preconception, very important topics. So let me bring yourself in, and the floor is yours, and I'll bring up your presentation as well.
Okay, let me open this up. Just 1 second.
Excellent.
Right. Good morning, everybody. Good afternoon. I'm Olga, like I said, and my life's work really is helping women live, thrive, and bring life safely into the world. So today I want to share very briefly an innovation born out of heartbreak, but also hope. It's a very simple, powerful tool that can stop women from dying, when they should be celebrating new life. So the urgency of maternal health, we already know that every single day around 800 women lose their lives due to pregnancy-related complications and risk, and this is across the world. And the thing is, we do really know how to prevent this, but because that is not happening, we're losing mothers every single minute. Here in the US and likewise in the UK, Black women, just using that as a case, are 2 to 3 times more likely to die due to pregnancy-related causes. And it's been shown severally in different researches that about 60 to 80% of these deaths are actually preventable if only we act in time. Yet across the world, half of these pregnancies are really unplanned. And so most of the conditions that actually lead to maternal deaths are the usual suspects. We talk high blood pressure, we talk preeclampsia, obesity, diabetes. And even with this, knowing that these usual suspects lead to death. It's still prevention and attention to ensuring that women don't die through this process still takes time. And sometimes healthcare workers or healthcare practitioners' interventions don't do anything until it is actually crisis time. So I truly believe that we're missing a huge window, an opportunity in truly reducing maternal mortality, which is prevention before conception. I think the one aspect that we really don't pay much attention is the economic burden of inaction. This is not only a health tragedy, it's also an economic tragedy. Prevention or preventative maternal complications currently cost the US over $32 billion. And closing this gap in maternal health alone could save an additional $3.5 billion. And when you add mental health conditions, metabolic disorders, lifestyle-related risk, there's also much more billions of money being lost. So prevention in this case doesn't actually just save lives. It also protects families. It keeps women alive. It protects our health systems. And you can see it also would save some money for different economies around the nations of the world. So here is where I introduce the PRS index. The PRS index simply stands for the Preconception Readiness Score Index. And this, I would proudly say, is the first much more detailed digital health scoring tool. And we've kind of done this just based on the simplicity of the credit score. So like how you get your credit score, your financial credit score, this is exactly how this index has also been modeled, but this focuses on women's health. So it is a very simple tool of 27 questions, which have been carefully put together. These are very carefully designed questions, and it evaluates the readiness of a woman for conception over 8 women's health pillars. These are science-backed. These questions were put together based off of consultation and meetings with medical professionals, public health experts, as well as maternal health advocates. So, and these pillars range from hormonal balance to mental health, emotional health, nutrition, physical health, and actually much more. It gives the woman at the end of the assessment, it gives them a personalized score. And it also profiles some very clear steps and recommendations that they can follow. And the idea behind this is truly just to empower women to know what exactly to change, how to ready themselves, what to check, and when to seek help. So it empowers them with the information to move forward in improving their health and well-being before they actually get pregnant. It's also very educational. In a way, it also, we've also created this so that we can empower women so that they're aware, because I think that's the one thing that is lost in this whole process of maternal health, of women getting pregnant, going through the process and post, is the education that come in between just knowing what is going on in your body and knowing how to manage that through the process of pregnancy. So this is the 8, this shows here the 8 pillars. And we've also tried to map these pillars against the economic burden. So the 8 pillars include BMI, body mass index, menstrual health, nutrition, medical conditions, which also looks at family health history, physical activity and sleep, immunity, infection and awareness, hormonal health and ovulation, and then we'll look at the mental, emotional, and spiritual well-being. And what this does is the middle graph maps these pillars against the economic burden of mental health conditions, physical morbidities, postpartum hemorrhage and obstetric issues, gestational diabetes, and hypertensive disorders. So we have really tried to curate this assessment based off of what the issues are. Now, with the PRS index, what it does is once women know what is going on in their body and how to effectively go through pregnancy in a healthier state, we have healthier pregnancies, we have more mothers alive, we have more babies healthy. And then this in turn would lower maternal mortality and also hospital. So my next slide. We look at the institutional use and scalability. So as much as, this is an assessment for individual women to take, we've also built it in a way that it can be scaled. Clinics, universities, governments, NGOs, churches, any group that actually has it in mind to improve maternal health or advocates for maternal health can use the PRS index. We've customized the dashboard so that organizations who use it can collect data. They can really see the risk patterns based off of the women who take these assessments. They can use that information to measure impact, and then it would help them to go ahead and design data-driven interventions, like both clinical and non-clinical interventions that can truly improve the health of the women who want to go into pregnancy. And we are really building this also to be culturally adaptable for global implementation. So the early adopters, there's a group of women who've used this, and some of the feedback that we've also received is making it accessible, in different languages so that people can use it in any setting, especially those in underserved or rural areas. And the next is our current deployment and future goals. So currently, we are already running some pilots in Nigeria, in one of the top teaching hospitals in one of the southeastern states in Nigeria. The pilot is currently going on. This just kicked off a couple of weeks ago. And also in a family health practice here in the US and in Canada. And last week, we currently got an approval from another state in the south and east of Nigeria who wants to run this through their Commissioner for Health. So this is picking up, but there's a lot more to do. But whilst we're still gathering all of this formal, outcome data, the early users who tried this assessment have also shared some empowering, feedback, which has been really great, and, expressed that this tool is needed. A lot of them did say we didn't have this, whilst we were preparing for pregnancy. So this is just the beginning. Our goal is to then integrate AI to deliver more, smarter, context-aware recommendations for the women after they've taken the assessment. And in 2026, we're looking to also launch a palm-sized device that can work offline. So this can be used anywhere. And then moving forward into the years 2027, we plan to integrate advanced blood analysis, which would also help with giving more precise insights into what's happening, in women's health. So this is it. We are truly just here. I'm grateful for this opportunity, but we know that we can't do this alone. We can't transform maternal health alone. So we're truly open and looking for you to partner with us so that we can scale this even to settings that will really need this. We want to pilot this more. And we're looking for obviously funding and investments, and also would be glad for you to open up your professional, networks for us to be able to share more of this as we continue to really shape, the way that maternal health is looked at. Prevention truly has come to stay and is the future of healthcare. So let's work together and make this happen. Thank you again, Gareth, for having me today.
No, you're very welcome. You're very welcome. No, it's a pleasure. And we'll make sure all the links are put in the chat. And if anyone has any questions, they can reach out to you. And you're on LinkedIn, so people can reach out to you there. I think it's very important to understand the context, even from the UK's perspective. You have 700,000 women currently waiting for gynecology services. So there is an enormous need here. Some of the projects that we're looking at is like, how do you develop polyclinics for women's health on the high street, for example? So Olga's solution can easily fit into that dynamic. But let me go to Priti now, and Meds on Time. The floor is yours, Priti, and I will add your presentation, and we are excited to hear more.
Thank you, Gareth. Hopefully this works because... So I'll try anyway. Good afternoon. My name is Priti Patel and I'm the Director of Meds on Time. Meds on Time has been created to bring together the world's leading digital medication adherence systems and support platforms. Sorry, my
Yeah.
Screen has just decided to move. Support platforms into one toolkit to support people along the care pathway to help them take the right medication at the right time. Affectionately known as the DMAT, I'm going to give you a quick overview of the Digital Medication Adherence Toolkit. So a number of rigorous reviews have found that in developed countries, adherence amongst patients suffering from chronic diseases averages only 50%. And of those people, and it's even lower in developing countries. That means half of the people who are given vital treatments, whether for diabetes, hypertension, or heart disease, are not receiving the full benefit. Oops. Hopefully it moves. Come on, screen. Sorry, my slides are stuck.
There you go.
And oh, it keeps missing a slide. Okay, so poor adherence leads to preventable hospital admissions, avoidable disease progression, and sadly even deaths. For society, this translates into a huge financial burden. In the UK alone, it's estimated that £1 billion are wasted each year on unused medications, not to mention the extra costs of emergency care, GP appointments, and long-term complications that could have been avoided. The consequences are enormous, not just for the NHS and adult social care, but also for the patient and the support network. The World Health Organization has gone as far as to say that improving adherence would have a greater impact on population health than any advancement in new technologies. Think about that for a minute. Even with all the cutting-edge technologies available, AI, genomics, robotics, ensuring people simply take the medicines they already have correctly and consistently would save more lives and improve more outcomes. That's why I built the DMAT, to support medication adherence, as it isn't just a matter of individual responsibility, it's a public health priority. The DMAT brings medication support early into the care pathway, using digital tools that inform the support network what is actually happening. By addressing medication adherence, we can improve quality of life for patients, reduce stress for families and carers, and ease financial pressures on health systems. The solutions are within easy reach: better patient education, informed carers, digital reminders, and smart dispensing technologies. What we need is a commitment to put medication adherence at the heart of healthcare policy and practice. 8 minutes isn't very long, so I'm going to whip through these. Please get in touch after this presentation if you'd like any further information on the systems I've showcased. The early part of the toolkit is all about education and simple checklists to support people on their medication journey. I Manage My Meds has been created by the University of Bradford through NIHR funding. The programme is geared especially towards older adults taking 5 or more medications, addressing the challenges of polypharmacy. Its content is co-designed with patients and carers, not just clinicians, to ensure it's practical and patient-centred and is available in English and Urdu. The support covers key topics such as always check what you get, keep on top of your supply, routines and reminders, changes to watch out for, and time to ask for help. MedWiki is a digital health platform that helps users understand prescriptions by allowing them to upload photos of their prescription and then ask MedWiki to explain the medicines and associated health conditions. It offers the world's largest health video library, created by trained pharmacists to answer questions like what is the medicine, how to take it, and side effects. The platform also has lifestyle advice, nutrition, fitness, and information on alternative therapies. Recently, they launched a series aimed at teen health. Available in multiple languages, including English and Indian dialects, MedWiki, I believe, can support to reduce health inequalities. PillPal is also a new service recently launched that uses WhatsApp to remind people to take their meds. Next is Smart Respiratory, which supports around asthma. The Peak Flow allows patients to monitor their asthma, whilst the dongle monitors how much medication is left in the inhaler, ensuring patients get the meds and monitor their usage. Forgetting to take your meds is one of the most common reasons why medication adherence is poor, and that's where the Smart Pill Box MedPer comes in. Rather than sorting your meds out into daily doses, the MedPer unit allows your meds to stay in their original packaging. So when it's time to take your meds, the right compartment lights up and the unit beeps for 1 minute every 5 minutes for a total of 15 minutes. Simple and easy to use and set up, MedPer uses Wi-Fi and Bluetooth to connect. Supporting up to 8 different medications, it offers a new solution to the traditional MDS trays. If meds are missed or the boxes are opened at the wrong time, supporters can be informed through the app with a one-off cost of £99. The MedPer launched in the UK this week. Backed by academic research, the MedPer is featured in research spanning cardiovascular, diabetes, and supporting elderly with their meds. And MedPer provides peace of mind for family and loved ones, as shown by these reviews. MedPer is also featured in the Atlas of Innovations. The Atlas is a collaborative activity coordinated by the International Union Against TB and Lung Disease, the Gates Foundation, and the Indian Council of Medical Research. From MedPer, we move to the sophisticated Yvondos system that I like to think of as a mini virtual ward in a person's home.
It is time for your medication. Please press the button. Medicine sachet coming. Please wait. Take the sachet, please.
Established in Finland in 2008, Yvondos is extensively used in the Nordic and Scandinavian countries and recently entered the UK. Yvondos was the catalyst to creating the DMAT, as the UK finally had a secure dispensing solution that can support people with complex medication routines. The Yvondos system is a locked system that only dispenses meds at the right time. On average, the Yvondos system has an average adherence rate of 99%. Meds are dispensed in pouches, and the medication information and timings is written on them. If meds aren't accessed in the allocated time, they're drawn back into the machine and locked into this container at the bottom. Up to 8 weeks of meds can be stored into the back of the unit, and there's an optional camera functionality that allows care providers to have a two-way conversation to provide remote medication calls. Later on this year, the Yvondos will integrate with VitaCam, where they will be able to monitor vital health data like heart rate, SpO2 through the camera, allowing care workflows to be streamlined even further. Guardian Angels in Surrey have recently started using the Yvondos to support their service users, allowing them to increase capacity within their business, offer the service at a reduced rate to support to the user, and support greater independence for the service user and peace of mind for the support network. The technology provides an in-year cash release of nearly £14,000 compared to a traditional in-person care call. So I've thrown a lot of information at you, and I'm looking to get these technologies into care pathways and finally get some real-time data around medication adherence. Like I said earlier, supporting medication adherence isn't a matter of individual responsibility, it's a public health priority. Please help me improve medication adherence to 80% or more. Thank you, and you can contact me at priti@medsontime.tech.
Fantastic. Thanks very much, Priti. That was fabulous. I mean, there's a huge opportunity there, particularly around medicines and adherence. I've worked in this space for many, many years. We've got huge challenges. Let me hand over to Vincent now. Vincent, the floor is yours. A bit of pressure to put on you. We've had some comments in, so just so people can see some of the comments that we've had. So this is amazing, just from some of the presentations. And then from Patricia, for decades, we have focused on post-care for women and their babies. So it's excellent to shift the focus on prevention. So that's absolutely what we need to do. So Vincent, over to yourself. I will bring up FootSnap, and you're very welcome. I think you're on mute. Oh, let me just make sure. Yeah.
Okay, thank you, Gareth. So my name is Vincent Piselé. I'm the founder of FootSnap. And what we are building is actually the world's largest database of biometrical data. And how we do this, we build a technology that turns your smartphone into a 3D scanner, but a 3D scanner that does not only capture volume, but also actually the real to life data, enabling us to create digital twins of body parts and full bodies as well. The problems we are solving, if we can go to slide 2. So the problems we are solving, because the scanning itself is of course one thing, but what do we do with it? So we see that within the several industries there is a lot of issues with ill-fitting gear, shoes, even medical devices like orthotics and prosthetics. Yeah, and other than that, we also see that in the current stage, a lot of practitioners are still doing a lot of manual measurements. They have limited access to biometrical data, and due to a gap of follow-up of practitioners, we see that a lot of knowledge actually is being lost, meaning that all of the knowledge that the retiring experts take with them in retirement is not being transmitted over to the next generation because there is not enough time, and there's also a big gap. For example, in orthopedic technicians, for more than 20 years there were nearly no follow-ups. Yeah? Meaning that anybody who comes into this, they don't have the time to rework all that data. Yeah? So other than scanning, we actually are connecting. Yeah? So we are connecting this data to real life solutions. Yeah? And this can take us to the next slide. Yeah. So a few examples of what we are doing currently. Yeah. In the footwear industry, given that we currently focus on the lower limbs, but we can do the entire body as well, we are building solutions to create footwear, for example, that will help and even prevent people with certain morbidities. For example, people that are developing diabetes. Yeah? If we recognize those things in early stage, which can be done through our technology, we can actually also steer the way the shoes need to be developed to help that person and to help them not only to walk comfortably, but also to prevent, for example, potential future ulcers. Yeah? That's one example. The other thing we can do is, of course, if we scan a person in full, you can do a lot of diagnosis based on recognitions on the skin. Yeah. So we have several results already from people that were scanned with our smartphone. We passed this on through medical practitioners, and they literally could read the health of the person on the skin. Yeah. And so we're developing this further so that it actually becomes a standard way of generating the necessary data for diagnostics. Yeah. And the long-term vision, although we're already using it as well, is that we literally can replace lost limbs by an identical copy of the lost limb. Yeah. So in the prosthetics, we see a lot of involvement. We see a lot of development of prosthetics that already can be connected to the nerve system, where you can move your robotic hand even better than a natural hand. But what we still see, and that's a problem that keeps coming back, is that the hand or the leg that's being produced always looks robotic. Yeah? And through the capture of our data, we could literally come up with, for example, silicone solutions that could be printed with the exact detail of the lost limb. Now, how is this possible? Of course, you need to have done a scan prior to losing a limb. Yeah? Or what's also, and that's the closest thing to reality, the other limb that is still intact, we could scan that, mirror it, print it on the silicone sock, and then put it over the robotic hand or leg, and you pretty much have the closest thing to your old leg again. Yeah? So these are practical things that we're putting into the market. And we of course can still use a lot of help within the medical world, because we're mainly known in the sports and fashion industry right now. But we see a lot of practical use cases other than replacing lost limbs. In the medical world. Yeah.
Thanks a million, Vincent. Fantastic to hear these solutions coming to the fore. I hope we've given you an insight. We've really covered quite a spectrum of innovations here today. You started off with, early years, the Mothers Hub. I'll put all the links. We'll make sure the links are in the chat. Meds on Time with Priti, and then FootSnap with Vincent. These are very much innovative projects and programs that we want to scale, that we want to help and support. Our next Innovators Show will be at the end of November, 28th of November at 1 p.m. That's the next show. So I do hope you can join us. Stick it in the diary now. From myself, Priti, Olga, and Vincent, we'll wish you a great weekend, and do join us on this journey as we build a new ecosystem, a preventative model of healthcare, which is focused on empowering people to manage their own health and well-being by giving them the tools to do that. So do check us out on the website, and from myself and my guests, we wish you a fantastic weekend, and we'll see you in November for our next Innovator Show. So from myself and the guests, we'll end this stream. Thanks, everyone.
Thank you.